All right, guys, so today I have with me John Renko of GoLove CBD Oil, and he's going to talk. They have an amazing product, which is a vaginal lubricant, and it is quite amazing. I've shared it with clients, I've shared it with other colleagues, and I really, really love it. And so I wanted to bring him on so he could share more information about that product, about what they have going on, and about the benefit of CBD oils, because a lot of you guys are constantly asking about CBD oils, their uses, are they beneficial, and so on. So I just wanted to bring the expert in. So thank you so much for joining me.
Hi, it's great to be here. Thank you for having me.
Yeah, so tell me a little bit about CBD oils, general overview, how beneficial are they really?
They, the cannabinoids in the cannabis or even industrial hemp plant offer a lot of therapeutic benefits. And most people are familiar with the psychoactive effects that you get from THC. But in recent years, there's been a lot more interest in CBD. And most people throw around the term CBD oils and just kind of have that as a super class of everything. It really depends on how it's processed. So CBD can come from marijuana. It can also come from industrial hemp. They're really the same plant. It just depends on how it's classified by the government. Industrial hemp has less than 0.3% THC in the plant. So when you extract from the plant, you're getting mostly CBD and some other cannabinoids like CBN, CBG, et cetera. So all of them have different benefits. CBD has been studied a lot more recently. And where it's getting a lot of interest is the anti-inflammatory, anti-anxiety, and pain relief. So it's can't really make claims around those types of things. However, anecdotally, this is what people are observing when they're using CBD-based products. And there's a lot of factors that go into that: dosing, how it's administered. Are you smoking it? Are you taking an oral tincture, or is it applied to like vaginal mucosa or a topical? So there's a lot of different elements that really affect what it's going to do, how fast it's going to do something. Where we focus obviously is making this lubricant that can be used internally because it's water-based. And so we saw those types of therapeutic benefits as beneficial to use in a lubricant. And what we're finding is people that have pelvic floor issues or endometriosis and other things are finding some amount of relief from using the product of administering cannabinoids vaginally. So it's a great win for that audience.
Awesome. And are there any known side effects to using CBD oils?
The one thing that, there's a couple things that start to come up. So CBD's been identified for some like epileptic type issues. And so there's very high dosages that people use, and that's not present in the types of products that we're talking here. I mean, people are taking 500 and 600 milligrams twice a day for therapeutic situations. And there are things to consider at those dosages, but you're not dealing with that, in most of the products that you're finding on the internet or even with GoLove. Where I would draw the line is if someone's trying to get pregnant, I would consult with your physician. My understanding and the research that I've read is that it can interfere with conception, possibly. So that's an area where I'd steer clear. Another question that comes up is whether or not you can use CBD products when you're breastfeeding. And what research says there is that about 5% of whatever dose you're taking is going to find its way into the breast milk. So I think that's a fairly small percentage, but if you're wanting to be very safe, you would steer clear of that. And then they are starting to publish and study different drug interactions. That's probably the main thing that any kind of physician would ask is, what are the drug interactions? And so they have found interactions with things like warfarin or Coumadin and blood thinners. There are situations where if you're taking a very high dose, again, not what we're talking about at GoLove or any of these types of products, that they've had to reduce the dose of the blood thinners in conjunction with CBD. So, and again, very high doses, other situations. But those are the important things, and this is where the government and everyone's been like very cautious because we need to do our due diligence on that. So those are the types of things that I've seen that have like authoritative information behind them. So far, I feel like it's fairly safe. The more dangerous thing is all the claims that people make about what it does, and it's great for this, and it's great for that, and it does not solve everything. It has good benefits, and we're still learning as we go.
Awesome. And so you guys have created a vaginal lubricant. You've partnered with a pelvic therapist, and you guys are working or have worked to develop this lubricant specifically for people who are having pain with a variety of diagnoses. What have you found based on your experience in now working with clients, having had the product out there for a while? What are people saying with regards to the product?
Specifically, the people that have a pain condition generally it's the audience that finds the most relief from something or from GoLove. When you're just thinking CBD and that would be cool and I bet it's going to just do something great for me, and you have no conditions, no issues whatsoever, those people tend to be unimpressed, right? Or the comments are, hey, it's a great lube, I like the water base, and it's fine, it's an excellent lube, but if you're looking for something above and beyond and have no issues to begin with, it's a nice lubricant. You are getting CBD. You might get an anti-anxiety effect, but it's not going to be something impactful like you would find with THC products. And I think sometimes people just hear CBD and think marijuana and think getting high or that something else is going to happen. And CBD is non-psychoactive, so it's not going to do anything like that. For the audience that has pain conditions, some, many, most, I steer clear of saying everyone's going to get relief because that's not the case. But a lot of women that use it that have different types of pain conditions or pelvic floor issues are finding a little bit of relief from those types of situations. The pain anxiety thing it seems to be like a feedback loop, right? If you have pain and you're talking about penis and vagina intercourse, you have anxiety, you're nervous about it, you engage or whatever activity you're participating in, and then you have pain, and then you have more anxiety, and then you're clenching more, and so there's a feedback loop that can occur. So it is kind of a double win with CBD, where the CBD, and we can talk about the science of how this works, because that was important to me to be able to talk to other medical professionals, like what's actually going on. But there is a process by which it's interacting with receptors that helps reduce anxiety. And if you're reducing anxiety, you're going to, kind of mitigate that feedback loop. And those are the types of things that we see where people are just a little more at ease, a little more comfortable. Because it's water-based, it's safe to use with condoms. I think if I just zoom out a little bit, one of the things that you see with CBD products is they're mostly oil-based. And the reason being is cannabinoids are not water-soluble at all. If you take CBD or THC or any other cannabinoid and try to dissolve it in water, it just won't go. Not even a little bit. And so where we spend a lot of our time is making sure that we have a water-based formula that serves several purposes, just because Dr. Sadie Allison is who my partner, and she's a sexologist and educator. And so it was very important to make sure that we were making a body safe, female-friendly product, clean, simple, short list of ingredients, water-based, so that it absorbs well, doesn't leave residue. Oils and silicones are nice in their own right in certain situations, but they also can cause problems for some women. So, we wanted to make sure that we were doing things with a water-based formula, which was really, I think, the key differentiator with what we did, and the amount of CBD that was in there. So got off track there, I think, on the question.
that is huge, because so many people now have irritations to so many things, and so sometimes it is hard to find that lubricant that doesn't contain phthalates and parabens, and it's water-based, and it doesn't have all the added extra stuff in there. So it's really, really good that people can know, oh wait, I can use this product, but it's not going to irritate me and further add to the issues that I already have. And so what is the durability like? Because we know with a lot of the water-based lubricants, they tend to not be as durable as some of the silicone lubricants, or for example, with intercourse, immersed in water and things like that, then they tend not to be as durable. So what are you finding with regards to durability of the lubricant?
In the class of water-based lubricants, it lasts, it has a nice longevity. It's not going to compare to a silicone. No water-based product's going to compare to a silicone. Silicones are large molecules, and I get into all the science of all this stuff. So
I love it.
The general rule when you work with, like, we work with a PhD formulation scientist, and kind of married her excellent skills. She came from beauty and Neutrogena and Johnson and Johnson, and then we had all of our requirements. And one of those little boundaries that you learn about is something called the 500 Dalton rule. Dalton's is just a measure of molecular weight and molecule size. Silicone's a very large molecule, and so it's above this 500 Dalton threshold where it doesn't absorb, and that makes sense. You put silicone on your hand or your vulva or what have you, it's not absorbing into your skin. It stays there. It's kind of hard to get off, and that's just because it's a large molecule. And water is not, and the ingredients that we put in are not large molecules. They're designed to absorb, and that's a good thing because the CBD is in that formula, and you want it to absorb into the system and bind with your receptors in your body. So if it stayed around forever, then it's probably not absorbing into your system and giving you the therapeutic things that you wanted out of the CBD in the first place. So, but going back to the longevity, it does last a long time for water-based. Our thickeners and slip agents are twofold. One is hydroxyethyl cellulose, which is plant-based cellulose. It's a very common slip agent that's used in lubricants. And we also chose locust bean gum just because it's also plant-based and gives it like a nice texture and slip as well. So those tend to work nicely together and last a while. So that's very positive. There's a few other things as we just talked about properties of the lube that we put a lot of thought into. One was being pH balanced. So our finished formula is around pH 4. Normal, healthy vaginal mucosa is going to be 3.8 to about 4.4. It depends on where you read, but it's low 4s. It's acidic. It's natural. It's how a woman's vagina keeps things inhospitable to bacteria and other things. So you want to introduce a product that also has that pH, so that you're not getting things out of balance and introducing the possibility of bacterial growth or yeast infections and things like that. So that was an important consideration in what we did. And then there's some other humectants or skin moisturizers that we put in there for women that have dryness. So there's sodium hyaluronate. I'm sure most women are familiar with all those fancy, expensive hyaluronic acid serums that go into the eye or whatever. And sodium hyaluronate, which is what that is a super humectant. 1 gram of sodium hyaluronate binds with a kilogram, 1,000 times its weight in water. It makes it really nice. So it actually, this is funny. I actually have some here because it's prepared. So this is a whole big jar of hyaluronic serum. And that's actually what goes into the product, just one of the ingredients, but that's a nice moisturizer, and women love it.
Awesome. So for a lot of those women, like you mentioned, some women will deal with issues with vaginal dryness. So whether we're talking women with hormonal issues, women at menopause, women who are, postpartum or whatever have you, and they're now dealing with vaginal dryness, a lot of times, we may recommend a vaginal moisturizer. Is this product something that we can use because of the different moisturizers present within it? Is this something that they can use on a daily basis, just taking maybe a dime-sized amount and gently massaging the tissues around the vulva just to kind of add some moisture there?
Absolutely, and people do. It's perfectly acceptable. I even use it on my hands, right? So if I have like any kind of dryness, I'll actually just rub it into my hands. It doesn't leave a film or anything like that. It's just water. The formula is 95% water by weight. It's mostly water with some key other ingredients in it. So it's very gentle in that regard. And it's perfectly acceptable to use that like a daily vulva application for comfort. There's no issues.
Nice. Very, very nice. Is there anything else that you want to share with us? And I know you love the science, which is why I absolutely love chatting with you, because I can geek out about those things all day long. Is there anything else with regards to the product and its use, or other related products that you guys have that you want to share with any of the listeners?
No additional products right now. We're just focused on the water-based lubricant. We do offer we've started manufacturing little 5 ml sample sizes for people that want to try it out before they go buy a bottle. So those are starting to be sent out and made available. As far as usage is concerned, there's a couple things that are just nice to know. Cannabinoids take about 15 minutes to assimilate into the system once they're introduced through a mucosal membrane, so your mouth or your vagina. You want to give it, if you're wanting to see the responses from the cannabinoids, give it about a 15-minute application prior to intercourse so that it can actually get into the system. If you're applying cannabinoids to the stratum corneum or the dermal skin, it absorbs far less and far more slowly. So that's why I'm specifically speaking of the mucosal membranes. The other thing for people that do partake in marijuana, there's an established correlation between CBD and THC, and they work synergistically better together. So if someone's looking for an enhanced experience or taking CBD and mixing it with THC, you can use the lubricant and you could partake in THC in your favorite method of delivery if you wish, and you're going to get a synergistic interaction between the two. They actually work better together. It's kind of like 1 + 1 = 4. CBD being 1, THC being 1, but you get a greater effect than you would individually with those. So there's people that enjoy marijuana, and this is a nice complementary thing because marijuana doesn't have that much THC often, unless it's bred that way and you specifically sought out a strain that is high CBD, but that's the exception, not the rule. So there's some things like that that are nice for folks. The other thing to mention, and it's a common question, is for people that stay away from THC, will this product show up on a drug test? And we specifically made the product with CBD isolate. Now, I'm well aware that broad spectrum and full spectrum CBD oils that have other terpenes and other minor cannabinoids are better because it's more closer to the whole plant. When we made the product with that, the lubricant came out like Dijon mustard and had a real heady, earthy cannabis smell. Just didn't think it was the right thing for a daily use or a lubricant, and so we chose to just stick with isolate. It's pure, and the lab analysis, every batch is lab tested, and the lab results are on the website and coded to the bottle and everything. And those show that it has no THC. It's actually non-detectable. You can't say 0, but you can say non-detectable. So HPLC lab analysis cannot detect the THC. It's not going to show up in a blood test because it's made with isolate. So
awesome. And now, if people want to find you guys, get samples, learn more about the products, where can they do that at?
We are online at GoLoveCBD.com. You can buy directly from the site there. We are showing up in various store chains as things permit, and we can get those out there with all the stuff that's going on with COVID. But the easiest place is just GoLoveCBD.com, and we're on Instagram at GoLoveCBD as well, and you can follow key information there.
Awesome. Well, thank you so much. And guys, he is a whiz when it comes to CBD, and not just this product, but the science behind it. So if you're like me and you just want to geek out and learn more about CBD and, all the fun things that are, the chemical compounds of CBD, John is a phenomenal resource. So for all you clinicians out there as well who have patients that are dealing with pelvic pain, endo, polycystic ovarian syndrome, IC, vaginismus, dyspnea, any type of, vulvodynia, any type of issues that are causing pain with intercourse or causing some vulvar pain. I love this product. My clients love this product. It's one that I recommend a lot. So please check them out. I think that they're a phenomenal resource. Definitely a great product. So thank you so much, and I will see you guys later.